Welcome to We the World and our 2025 MLK Manifesting the Dream event. Each year, we take time to remember Martin Luther King Jr. and his beloved community. And each year, we are thrilled to feature the many people and organizations who have taken action to be of service, not only in January and February, but all year round. We at We the World welcome you to take action and be of service at we.net/MLK from January 15th to February 28th. Please join us in being a part of this annual celebration and consider being of service in your communities and with us. Of course, donations are very appreciated at we.net/donate. My name is Yana Larson, and I am the HR Deputy Director of We the World. Today, we have a very special guest. Peggy Ann Berry is going to showcase the deep connections between climate change, public health, and water equity. Climate change is not just an environmental crisis, it is also a major public health challenge, disproportionately affecting vulnerable communities. Rising temperatures, extreme weather events, and shifting disease patterns contribute to respiratory illnesses, heat-related conditions, and the spread of vector-borne diseases like malaria and dengue. I'm not sure how to pronounce that word. Highlighting real-world examples of these impacts, Peggy will discuss here potential solutions and emphasize the need for global cooperation in tackling climate-related health and water crises. Welcome, Peggy. Thank you for being here.
It's always great to be here and to help out We the World for Martin Luther King.
Yes.
Okay.
All right. Yeah.
So let me share my slides then.
Yeah, there you go.
And of course, this is what always happens is I start something and I always have it on the second or third slide. And again, my name is Peggy Berry. I'm a PhD prepared registered nurse and also a certified occupational health nurse specialist. And I'm going to talk about climate health and water equity, which, and I'm going to tell you it's going to be with a nurse's spin. I can't help myself. So if there are any questions, you can put them in the chat or afterwards you can ask me. Okay. So as a nurse, I always have to do this. We are going to have some objectives as I go through these slides. We're going to discuss the impacts of extreme weather. We're going to look at what we might be able to modify in policies or procedures for climate and discuss your individual strategies to prevent weather-related illnesses. And of course, injuries can go along with that too. We're going to do this for about 3 hours. Is that okay? No, it will be an hour or less that I will be talking to you about these things. Now, the one thing is it natural or is it man-made? There are a lot of strong opinions associated with climate change or now climate crisis. Climate change refers to the long-term shifts of temperature and weather patterns. Such shifts can be natural, due to the change of the sun's activity or large volcanic eruptions, and I hope we don't have those in my lifetime or my children's and grandchildren's lifetimes. But since the 1800s, we have seen that primarily due to the burning of fossil fuels like coal, oil, and gas, we have generated a greenhouse gas, which kind of like keeps the heat in and is raising temperatures. The main greenhouse gases that cause climate change include carbon dioxide and methane, and these come from using gasoline for driving, coal for heating a building, or clearing a land and cutting down forests and burning the forest. So agriculture, oil and gas operations, are major sources of methane emissions. So, according to the United Nations, human activities are the main driver. And if you want to look it up, there is the link in the slide for you to click on. Yeah. All right. Does the Earth have a temperature? Yes. I took this graph from the National Ocean and Atmospheric Administration, or NOAA. In 2024, I looked at it again today, and all of that information is shuttled into a research portfolio that is kind of off to the side now. So it may be difficult to access. Globally, 2024 was the hottest year on record. Let that sink in for a second. The summer of 2024 was 1.2 degrees warmer than in 1991 to 2020. That pushed us past the previous hottest summer, which was just 2023, by about 0.03 degrees Celsius. So it might not sound particularly hot on face value, but remember, it's an average that includes temperatures like the Arctic, Greenland, as much as the summertime temperatures experienced in those latitudes like North America and Europe. But because of that heat, we are seeing extreme weather events. Since 1980, the frequency of extreme weather events has increased, as seen with Hurricane Helene. As this hurricane was downgraded to a tropical storm, it moved inward, and rains events from 2 to 4 inches an hour led to flooding, like in Asheville, North Carolina. And you think Asheville is a high point in North Carolina, but they had flooding. And they are still recovering from this. Even so, we can have flooding in New York City. This was another tropical storm. Even though it weakened, the rain and the wind damage can be devastating. According to climate.gov, which is still available, we need to prepare for more heavy rain events that will increase across the United States with the warming conditions that we have and with the water vapor. And we need to talk more on solutions down the road. I mean, when we look at the naval base at Norfolk, they are building barriers so that they can continue to work out of that port. You know, there are solutions, but maybe it's time for us to reduce our carbon footprint. Now, I like to show this picture because in 2024, we were driving back from Missouri to Dayton, Ohio. And yeah, that's where I live, Dayton, Ohio. And we passed through this storm on Highway 70 going east. And when we hit Terre Haute, the lights were all out and they had a tornado go through. We had trees and other debris on the highway as we were driving back. So it's not just being in your neighborhood, but it's also when you're traveling out of state, you need to be aware of these types of weather events that occur. So the other side of it is that every climate disaster is a chemical disaster. As a prior Red Cross volunteer, I know floodwaters have everything in it, whether it's snakes and alligators or crocodiles or bears, oh my, down in Florida or around the Louisiana area, or whether it's chemicals that escape from their holding ponds within the Great Lakes and Ohio River Valley. I had a conversation with a neighbor, and this was not even a year ago about the fact that when you have flooding, you have chemicals in that water. And he could not believe me. And I said, look, if you have a holding pond that's out and there's nothing on top of it to keep that water that's filled with chemicals or coal ash in place, it's going to flood out into the floodwaters and you are going to have issues. I had a volunteer who went into Asheville and told me that some of the people who had their hip high waders in as they were going through floodwater found that they started to disintegrate because of the chemicals that were in the system. So just to let you know, you can have water everywhere and not a drop to drink. So just to let you know about this is you look at this and you have Katrina, which was considered a major event. And then you have Helene, who's an even more massive event, as you see all of that cloud cover. It's just incredible. Now, we also looked at Hurricane Milton too, and when you see the extensive cloud cover associated with hurricanes, you know you're going to have a wind and rain coming up the coast or into the interior of the United States. Now, the other side of this climate crisis is climate refugees. And I was looking up facts regarding this. And with climate change, there's an increased recognition that it is a driver for human displacement worldwide. In 2022, climate-related disasters triggered more than half the new reported displacements, with nearly 60% of the refugees residing in countries highly vulnerable to climate change. The total number of forced displaced individuals globally reached a record of 114 million people, individuals, families. And an increase of 4 million has occurred since May 2023. The surge is attributed to ongoing conflicts and escalating impacts of climate change. And when you have water issues where you don't have water, you are going to have climate refugees. You are going to have climate refugees if you end up with desert, I can't even say it, when your land turns to desert. Just as with the northern part of Africa, that whole area 7,000 years ago was a lush savanna with animals and lakes, and now it is a desert. Maybe it's time we start working on how we can recapture that desert area. So the other side of it is we know the crisis that Europe is already experiencing with climate refugees. Consider how this is going to increase within the United States as people in the Gulf Coast and the eastern seaboard have to move inward as the sea rises. Not many people think about that, but it's time that people start doing that. I will probably use my son as an example with this. He moved from almost downtown Savannah to the outer belt, away from Savannah because of the concerns of flooding and hurricanes coming into the area. I still don't think he and his family are quite safe. They probably need to move further and more uphill. Okay, this is a wonderful photo. I don't have who it is from, but this is one that Climate Reality uses in their talks. The light blue color that you might see here, that is the Earth's atmosphere. That's all that's between us and outer space, but it acts as a blanket around the Earth to keep the oxygen in, but it also keeps all of the methane and carbon dioxide and volatile organic compounds and smoke. It takes a long time for that to dissipate and go back into the soil. So this is an area that we really are going to need to especially protect, because if you don't have clean air, you don't have good breathing, you don't have good workers. Same way with water. The water's got to be clean. Now, when I look at this, I look at climate is health. Everything, our bodies are surrounded by our climate, our environment, whether it is, I have Hashimoto's, but I was exposed to radioactivity when I was in utero. And that will also create a genetic predisposition to thyroid disease. People who smoke, well, they end up having issues with their lungs. But likewise, I was watching a mayor of, I won't say Honolulu, the Big Island, Hawaii, where they had a volcano going off. And that man was coughing because that smoke is in the air. So everything depends upon the environment or the climate that we live in. And that was just a great little photo, again, unknown author, that I grabbed to tell you climate is health. It doesn't matter whether it's drought, heat, hurricane, tornadoes, or air quality, or 5 feet of snow. As a matter of fact, we're getting snow today. Climate affects human health. The other side of it is climate is health. And as a nurse, before I get into some of the cold, hard facts of how climate impacts health, let me tell you, this is a crisis. It is not only a climate crisis, but a health crisis. And it is my duty as a nurse to educate our community, our state, our nation on all of the issues. Oh, well, yeah, our spouses. We need to always educate and help illuminate the fact that what's going on is not only affecting us locally, but globally. We are the best advocates, nurses are, for our patients and our families' health. And as mothers and grandmothers, we need to advocate and continue to advocate for the health of this nation. And I will get into that in just a little bit. Okay. I'm just going to touch on water equity because the BIPOC, Black, Indigenous communities, as well as rural, white, low-income communities, are having issues. There are areas in Appalachia, Ohio, as well as Pennsylvania, where fracking has tainted the wells and they cannot get well water. Some of them had not had water for years, and it had affected the town's well-being, and they had to ship water in. I think it's Demrock, Pennsylvania, had this issue. Water equity refers to just and fair inclusion, a condition in which everybody has an opportunity to participate and prosper. Water equity occurs when all communities have access to clean, safe water that's affordable, and their wastewaters are taken away, and those services are resilient against flood, drought, and other climate risks. We, as a community, as a nation, as individual citizens, we have a role in the decision-making processes related to water. We understand that having a oh, shared impact on the economic, social, and environmental benefits of water systems has to be for everyone. We just cannot let that go. I have seen water shutoffs during COVID, and you're thinking, well, how in the world am I supposed to wash my hands and stay healthy and go to work if they're going to shut off my water? And I'm not supposed to go out and COVID. It has made me very sad that in some instances, in treating water as a commodity, people are paying exorbitant rates just for water and for waste disposal. And in some areas in Louisiana, the waste just goes right into the stream because there is nobody to take care of it. There's no money either. So other issues with that, water is a right with the turnoff with the pandemic, the pollution from fracking. And then the other side of it is selling it as a commodity to bottlers so that, and oh goodness, I can't go beyond this. The fact that fracking to get methane uses an incredible amount of water. And once they have put their chemicals in it, it is unusable. And when it comes back up, it's radioactive. So what do? You have this waste brine that is radioactive, full of volatile organic compounds, as well as PFAS. And where do you put it? And that in itself is another issue that I could talk a lot about. But in Ohio, on March 6th, we are going to the State House through Buckeye Environmental Council to talk about fracking and educating our representatives on this issue. So, and I won't be there because I'll be in DC for the Great Lakes Health Conference. Okay, so what can we do? We need to build public support, build support for the community-driven regional water partnerships, and call for climate mitigation in the water section or sector. But we'll maybe go on to more with that a little bit later. So let's get into some of the health effects besides water scarcity with a warmer planet. And with a warmer planet, we have more pollen in the area. With more pollen in the area, with the heat and humidity, it pushes it down. There's more ground level pollen. And of course, we have our seasonal allergies. With the growing period longer, we will have more pollen for longer periods of time. And my kid, my daughter and my grandson, man, when pollen season starts, they are on their medication. So breathing becomes more difficult. And for some individuals who are our canaries in the coal mine, it becomes even more difficult because we have a warmer planet. Pollen, as well as other allergens and chemicals like smog, cling to the ground, making it difficult to breathe. If you remember, I think it was last summer, we had the smoke from Canada also blew in. And I feel for the people of California with the fires they have just been through, because not only have they been through the fires, but later on they're going to be going through the difficulty with some of the exposures from well, the fluorine burning up it's vinyl, okay? As vinyl chloride, that's a carcinogen. So what we have in our houses are toxic in another level, The Lung Association put out a 25th annual State of the Air report. It grades the air quality, and we are so exposed to unhealthy levels of ground level ozone air pollution, also known as smog, and soot. And this year's report for 2024, I'm sorry, I should say 2024's report said that there is an increasing amount of particulate matter in our air. It seems we have seen some impressive progress in cleaning up air pollution, thanks in part to the Clean Air Act, but even that is going to potentially become superfluous in the Trump administration. They do not seem to appreciate these standards because they think that it decreases productivity. This has no age difference. I mean, there's 7 million deaths attributed to air pollution, and 91% of the world's population lives in places where air quality exceeds even the World Health guidelines. When I think about this, a particulate matter of 2.5 reading going as high as 49.7 in certain months and with consistent readings will give you possibly more lung effects. And I would really love to have a pulmonary doctor right next to me explaining all of this material, but you're going to see more people not being able to breathe. You're going to see people having to use assistive devices in breathing. You're going to have more inhalers. You're going to have more people on CPAP machines because of sleep apnea, because of air pollution in their area. The carcinogen effects in itself is not good. So this is another website you can go to, www.airnow, and you can plug in your zip code and it will tell you what your air quality is and the ozone in particular matter. Red is unhealthy, purple is very unhealthy, and maroon is hazardous. You will not want to go outside at all. Orange and yellow, you have people who are your canaries in a coal mine. They will tell you that the air is getting more unsafe. Okay. And of course, if the AQI is in an unhealthy zone, you're going to have to avoid heavy exertion outside. You're going to have to stay indoors. You're going to have to close the windows. And you're going to have to run air filters, air conditioning, or go to a nearest cooling facility. These kind of unhealthy zones usually occur in the summer heat and associated with fires. Sunshine makes some pollutants undergo chemical reactions that produce the smog, and the higher temperatures speed up the chemical reactions in the air. Rain can wash it out for a little bit, but humidity can cause the particulate matter to attach to the water droplets in the air, dissolving pollutants and increasing airborne pollution even more so. Now, in a hotter world, it makes working harder. And I'm using migrant workers as an example here. As we all know, there are social justice issues associated with climate change. I have air conditioning, I have heat. I can stay indoors when the air quality is poor. I'm retired, but not really. I may be able to put solar panels or wind turbines in my yard, or I can put in a gas generator if necessary because I don't have the sunshine because of the trees. However, the BIPOC community or the rural poor don't have that opportunity. And heat from death is the #1 killer. How to stay safe in heat. And why am I talking about this in February? Well, it's because summer is coming and you need to be aware of how you can keep safe in this type of environment. Wear loose-fitting clothes. Stay in an air-conditioned place if you can. If there's no air conditioning, find a shelter, a public library, or go to the shopping mall to stay cool. Leave your credit cards at home, though. Okay. Do not use your stove. Take a cool shower or bath, and never, ever leave a baby or a pet in a parked car. And make sure you provide plenty of water and shade for a pet if they are outside. And I did not check to see if this is still up. This CDC Gov extreme heat is up still. I'll have to check that out. Now, if you're working, and I have to say this because as a occupational safety and health nurse, I usually also not only look to the community, but those who are employed at work. And some factories do not have air conditioning. They're a big open facility and all they have is fans. Make sure those fans are functional. You provide electrolyte drinks, frequent breaks, and access to water. And if outside, provide shade and provide access to water. And avoid the sugary beverages. This is for an individual as well as a worker. Water is your best friend in this type of weather. Now, for those people, some have a higher risk: pregnancy, older adults, the very young, people with mental illness or chronic diseases, obesity, and alcohol use. Heat-related deaths and illnesses are preventable. Despite this fact, approximately 1,220 people in the United States are killed by extreme heat each year. High levels of humidity and mugginess can make it seem hotter than it actually is. So when summertime comes, check on your neighbors, check on your friends, make sure they are drinking water and being safe. Just to let everybody know, these are the signs and symptoms of heat stroke. When I talk to nurses, I really throw this stuff at them. Okay, you've got a high body temperature, you're hot, red, dry, or you have damp, cold skin, fast pulse, headache, dizziness, nausea, confusion, loss of consciousness. And I have a 76-year-old husband, which I actually monitor him a lot because of his medication, because sometimes he doesn't think he's getting too hot because he doesn't feel it. So I have to watch him carefully. Treatment is easy. You move to a cooler place. You lower your body temperature with cool cloths, ice packs under the arms and groin, and don't give them anything to drink until you're making sure that they're not throwing up or having worsening or prolonged symptoms. Heat exhaustion gets even worse. And again, the treatments are about the same. Make sure that these people are safe because they can deny, but they need to be monitored. And if you have friends and family, especially elderly family, you need to check on them frequently during this time. Now, I got a couple stories to to talk about with us related to heat issues. One is my first marriage. We went to Colorado Springs for our honeymoon, and it got cold and wet. And so we headed to Arlington, Texas. And my then husband said, I'm going to take something home. I'm going to get some sun. Well, he ended up with sunburn so bad, he had sun sickness. Not only did he have the sunburn and the heat rash and the cramps, but he also ended up with fever blisters around his mouth and second and some third degree burns on his back. What can I say? This happens. Again, when you have someone like this, and I'll say I was 19 years old, I had no idea because I'm one of these olive kind of person where I don't burn, I just get darker and darker. So I've been fortunate that way. But this can also be a hereditary thing because my son did the same thing. And now, if he stays in the sun too long, he ends up with a rash and he gets sick and he starts to have a temperature. So he has to stay absolutely covered during the summer and wear a hat and take his vitamin D. So we all know about sunburn. We just don't know that you can get blisters and a heat rash and then end up having more problems than it's worth. It's hard to be allergic to the sun. These were some of the pictures that can be seen. As noted with any sign of sunburn, you first should get them out of the sun, or you should move yourself out of the sun and take a cool shower, apply cold compresses, and drink lots of extra fluid. If you're in pain, take ibuprofen or Tylenol, depending upon what is your over-the-counter of choice. And with severe sun poisoning treatment, some people end up having to have IV fluids, steroid creams or pills, and a prescribed painkiller because that can be very serious and can be really hard. Because I've seen it with my son and I've seen it with his dad. So let's get into the creepy crawlies with climate change. Growing up, I never heard of the West Nile virus, but now we have West Nile virus that has come up and over into Ohio and some of the northern states. And then we look at ticks too, and there are any number of diseases that are and illnesses that are seen through mosquitoes. So let's get to the creepy crawly flying crawlies we see. And these vectors are finding a higher range to fly and crawl their way onto our skin. With mosquito-borne diseases, we have West Nile, Zika, dengue, Chacoguanda, and I can't say those words either, Eastern equine encephalitis, La Crosse encephalitis, and St. Louis encephalitis. The one thing we don't have is polio like they used to have, which was a bacteria that went through to kids in the summertime in the 50s. I don't know about you. When I was growing up, my mother took us over to a friend's house to catch chicken pox, and now we know that's where we're going to get shingles from. So it's not a mosquito-borne illness, but these are things that we did in the 50s that we sure don't want you to do in the 2020s and beyond. So reduce your risk. Cover yourself with long sleeves, pants, and socks. Use insect repellent on exposed skins. I'm not going to get into the symptomology. Just make sure if you have a headache, a fever, fatigue, and vomiting, and you know you've been bit up, you need to go to the doctor to have an assessment as to what's going on. It could be West Nile. And we do have that Dayton, Ohio. Dengue, however, is in the southern states of Florida, Hawaii, Texas, Puerto Rico, U.S. Virgin Islands, and the American Samoa. However, there's nothing that says these things can't come up north and a mosquito bites somebody who was in Hawaii and then ends up biting somebody else and you have dengue fever. So continue to monitor your health. Make sure you eliminate any standing water around your home and ensure your screens are free from rips and tears. I have a dog, so I have to watch that regularly because she likes to jump in the window and bark at things. Now, the fun thing is the ticks. With ticks, you've got Lyme disease, you've got anaplasmosis, you've got all of these diseases that I've got here on the screen. I'm not going to read them, but consider that most tick-borne diseases are spread by deer ticks. But nowadays, we also have a Lone Star tick or a Rocky Mountain wood tick, and the one in Texas, actually, there's one disease that it ends up making you allergic to beef and you can't eat beef anymore. That would be hard for me because I like steak sometimes, just sometimes. So how do you reduce your risk? Again, wear long sleeve shirts, long pants, shoes, avoid tick habitats. If you're going to walk in the woods, walk in the center of your trails, check for ticks. Check your body, your clothing, your gear for ticks, your animals for tick, and then shower after being outdoors and put on clean, dry clothing. I have to take that off. Okay, other individual strategies. What can we do now? Now, the individual strategies, these right here, are for what we can do to help reduce our individual footprint on climate change. So what can you do? Stop your single use. Reduce fossil fuel use. If I can walk down to the store or to the pharmacy, I'm going to do it. If I can ride a bicycle somewhere, I'm going to do that. Fossil fuels are the main source. So as soon as you can transition to renewable energy, if you can. It may not be easy. Improve your efficiency in your house. Change out your light bulbs. Turn out lights. Put better insulation in if you can afford it. And I know I'm not talking to a community that can't afford. And if I am talking to individuals who can't afford to do these things, talk with your power company. There are still some grants available. They haven't turned everything off yet. So plant a tree. Trees help to keep the temperature cooler around your house. Use LED light bulbs. Replace your old appliances if you can. I don't care what they say. Stop using plastic straws. Forget your single-use plastics. You need to do your own thing in the time that you can do it. It's like I can tell you, I have changed out from using plasticware to just glassware for my food storage. But I can't always do that because my husband isn't quite there yet and can't not use little plastic baggies sometimes. See if I have more in here. Okay, community prevention. You know, if you can get on like a county board or talk with your county board about energy efficiency and renewable energy adoption, it might be a little difficult in some states, but other states are really there and giving it the old college try with tree planting and green roofs and community gardens. There's also some waste and reduction and circular economy issues going on. Not issues, initiatives. Talk with your county and your city representatives. And one of the things that I try to do every summer is I make a garden. I love to have my fresh herbs. I have fresh herbs in my windowsill now so that I'm not buying them. I'm growing them. I have a rosemary bush that I'm going to continue to have and replant and keep it going because I love rosemary. And plant your garden. Sustainable food is a great thing. If I could have like 10 trees of apples and pears in my garden, I would. And then I would give it to the food bank because that is also very important. So we need a local food system that works. We need to build resiliency into any city planning, like with Toledo. Toledo had floods all the time in one area called Junction. They worked it and now they have parks where, or what do they call their water gardens? You know, where it's going to flood, they've put in a garden to take and absorb that water and return it to the ground. Keep your awareness campaigns going, get your youth and schools involved, and just be a local policy advocate. And although this isn't the best word here, just transition is so important with these programs. Make sure it is inclusive. With organizations like with you're going to look at what you can commit to with net zero emissions. Any organization plays a critical role. Like in Ohio, Sierra Club is working in Cincinnati, which is home to Kroger's, and trying to get a plastic bag ban going so that we no longer have the Kroger plastic bags. Bring your own bags with you. That's another individual thing. Just talk with your organizations in around your area. Have them commit to a net zero emission with science-based targets. Adopt renewable energy and efficiency standards. It's going to be profitable for them to be able to cut down their energy use. Zero waste to landfill. Do you know how to create a zero waste even in your own home? And then look at sustainable travel and transportation policies. One of my pipe dreams is a train that connects Columbus, Dayton, well, Cincinnati, Columbus, Cleveland, and Toledo, and runs once or twice a day. That would be so nice to take a train rather than to have to drive to Cleveland for something I needed to do, where I'm the only person in the car. If I can take a train, it would be much, much better. So you need to be aware of greenwashing, and this is so important now. I just got a email today from US Facts, and it is all about how much money we'll be saving because we've discontinued USA aid, but doesn't really discuss the fact that US aid buys like $2 billion in lentils and rice from American farmers, so, and corn. So you need to be aware that any amount of greenwashing is going to happen as they try. One side says plastic straws are good, which we know they are not. And we're doing everything we can to make things a safer world. Where is the happy medium? Where is the real truth in any of this? So I think that is it for my presentation. If you have any questions You have my email there. You could call me. Be happy to answer any questions. Jana, Birgit, if you have any questions for me now, be happy to answer them.
Peggy, I do. Um, yeah, there we are. Wow, that was a very complete presentation, and I really thank you. Do you have time to stick around for a little bit and answer some questions
I
then?
do. I
Okay.
do.
I really appreciate it. I like what you just said about, because I'm in Ohio too, a train in Ohio coming from down south and then going up and then going back down would be such a cool idea.
Oh, it
I would,
would.
I would love that. What a good idea. And again, disinformation is such a problem. How to know what to pay attention to. And why do people think that plastic straws are so great now? Because you can make things with them? I don't know why.
Have no, I have no clue why this president thinks that plastic straws are great, other than,
Oh,
and
it was the president that said that. Okay, that explains
President
it.
Trump wants to get back to using plastic straws.
Oh, bless his heart.
Okay, one of the things I do wonder though is how much plastics has been integrated into our healthcare system. And then when you look at petrochemicals, how many of our own drugs are made of a derivative of a petrochemical um, pharmacy? I'm afraid to look. I really am afraid to look.
Yeah, like sometimes, what's the word? Ignorance is bliss, huh?
Oh,
So,
yes. It would have been great not to know any of this. And
exactly. Well,
possibly
like,
40 years ago, I did not. And I keep wondering what my impact, what my own footprint would have been had I taken this up 40 years ago instead of starting in 2012. I mean,
oh,
really.
let's think.
Yeah, we'll see. Maybe 40 years from now, I'll know what my impact is when I'm looking down. I don't know.
Well, that brings me to my next question, because, well, all right, I was gonna ask my first question, but now I'm thinking I'm gonna ask my second question. In these current times, with all the chaos coming from so-called leadership, environmental concerns are going out the window, the whole confusion with the CDC and medical research and humanitarian aid, um, y- you know, what can the typical non-medical person do well, besides what you mentioned, some very common sense, basic things. Well, maybe not common sense, but how can we protect ourselves and our loved ones when the what we thought we had in place and was moving along in the right direction about awareness and all that is what are we going to do? Just build bubbles for ourselves and just walk around in bubbles and I mean that's not practical.
Yeah, there's a lot of impracticalities. I would, for myself, okay, and I'm only going to say for myself, what do? I do a lot of prayer, all right? I
Mhm.
do a lot of prayer, and then I do some meditation. I find that in the morning, I actually have a meditation app called Balance, and I use that for guided meditation in the morning and sometimes to help me fall asleep at night. Um, the other side of it is, and where is that? Get yourself a book. All right. I've got a calendar and I have can't see it really well, but I have a um, journal and I journal. My journaling is so that I can put these thoughts out of my mind
Mhm.
and be able to rest. And the other side of it is resistance is rest. Take care of your health first, okay? take care of your health first, because the other things will come along, and we will survive the next 4 years. I'm only saying survive. I'm not saying thrive.
Thrive, yeah.
Okay, we will survive for the next 4 years, and we will continue to make a difference, whether we go to Washington, D.C. and talk about Great Lake health, or talk about a plastics treaty again in June. I'll be in DC doing that. We have to continue to light up Washington, D.C.'s senators and representatives' phones, because if they think they're going to lose the election in 2 years, they may be starting to bark our way. Okay. Um, but as I said, the first thing is you take care of your health.
Yes.
You can't fight sick. And if that
No.
means you get an extra, if you can find a way to get an extra air filter in there, if you can, make sure you switch over to fruit and vegetables more so than meat and poultry, obviously, with the egg prices right now.
Yeah.
And this is, the avian flu is not a process of climate change. We had the same thing going on, and it was called the Spanish flu back in the 1990s, which killed a whole lot of people. But what will be bad with this, the research has already been done. I think there's a vaccine already for the avian flu. But what would be worse than that is not coming forth with the vaccines because of how our government is currently being run. So
Yeah.
take care of your health first, eat right, get your, I'm a 7 hour a night person. If I go 8 hours one night, I'll sleep 5 hours the next night. So get your 7 to 8 hours of sleep, whatever you need to feel healthy, do it. Walk. I have 2 woods next to my house. Well, a couple blocks on one side, couple blocks on the other. And I walk in the woods almost on a daily basis. So with my dog, keeps her from
Pepper.
Pepper. Yes, with Pepper. I walk in the woods, and I've taken up a new hobby, which we talked about before. I am baking bread.
Bread.
I am baking bread, and I think it's called a focaccia. I
Yeah.
made that this past Sunday for Super Bowl Sunday,
Mm.
and I made too much, so about 3/4 of it's in the freezer now. Because and sourdough bread, I'm just a little baking maniac because it is my stress relief.
Yeah.
And appreciate your family too.
Well, and your family is so lucky to have you and your husband. You're taking care of him and lots of other people. You're amazing. I have another question. Um, in addition to public health, there are deep connections to healthcare workers, doctors, nurses, and all the people involved in medical facilities. They're exposed at a much higher degree, and there's mental health issues, depression, exhaustion, suicide. And I know that from recent experience that I had talking with medical professionals, that the pandemic was just
Oh,
horrible.
oh yeah.
And they lost friends, coworkers to suicide because it was just so much, too much. And it's got to be at a higher level now, not because I mean, there's still COVID out there, and
Oh, I know.
but, it's just this lack of awareness for medical research and qualified people in charge of such agencies, and you know what I'm talking about. Do we have any reactions, responses to that?
Well, you may not know this, but I've written 2 articles on nurse suicide.
Mm.
Okay. That's one was just and they're both free to look for on, unfortunately, Google Scholar.
Well,
You know,
you
but
you have to tell us where to find that information.
yeah,
So,
I'll ship it to you.
okay,
They're free links. You just click on I'll send them to you. But what I find interesting is that um I wrote this article, which was just, what do? You try and take care of yourself. You meditate. Again, you walk in the woods. Learn to ask for help. That's the
hmm
most important thing, is you learn to ask for help. All right. And the help is there. There's still helplines for it. But then a couple years ago, the Senate passed a bill to help healthcare professionals with suicide and cut loose a bunch of money for it. But you know what? Nobody recognized that there are other healthcare professionals and helpers. Nurses' aides weren't part of that,
right.
right? Respiratory therapists weren't part of that.
Mm.
Physical therapists weren't part of that. They were just looking to for physicians, for nurse practitioners, anybody who would be able to write a prescription to a patient, you know? So the idea, it has to be more inclusive.
hmm
And because, well, let's face it, those nursing aides, those techs, those assistants, they are the backbone of the healthcare industry. They're the ones that take care of grandma.
Right.
They're the ones that take care of those who are disabled.
Yes.
They're the ones that have the more, who make the less money.
Right.
And
And then
therefore,
the
they
people
need
that
to
have
have those benefits also. Hmm?
clean the facilities, sterilizing. I mean, all of that, nitty gritty stuff isn't gonna, the people at the doctor level, the nurse level, the whatever level, aren't gonna be able to do their work without the people there, the base, the foundation.
That's right. They're the
Uh,
foundation. They're the foundation of the healthcare system. They're the
mhm,
housekeepers. They're the cooks.
mhm.
And they don't make a lot of money either. And
No,
honestly, if I had a way of putting a earworm into our administration, it would be, you got a bunch of rich people telling us what we got to do. Well, give up 75% of your profit level and inundate this country with works programs.
mhm.
Give everybody a living wage. Make sure they're housed. We don't need any unhomed here. We are the United States of America. We can read
Land of
people.
opportunity.
Yeah, I mean, yeah, but no, we built this nation on the backs of slaves
hmm
and on the backs of migrants, for people coming in, for immigrants. And I am just so frustrated. I vacillate on angry, but if there is one thing that I have learned, is recognize that you are weary to the bone with all of this social media kerfuffle. Turn off part of it and then look for the one thing that you can make a difference in. The one thing you can do, whether it's push out social media, engage one senator. Uh, man, during the first Trump regime, I focused on that EPA executive from Oklahoma. And every time there was an earthquake in Oklahoma, I would put it up on his social media and attach it and say, look at what your principals have done to Oklahoma, and he did not last long. And I think that it is up to us to make sure that those people who are not qualified are inundated with that information, with our unhappiness, and help them move on. I am not advocating any kind of violence. I don't believe in violence. I do believe in protests.
What do you think Martin Luther King would say today?
Oh, well, he would say, I've seen the mountain. Okay. It's going to be a long hill to walk up, but we're going to reach that mountaintop. That's what he would say. And in the words of Reverend Barber,
Mm-hmm.
they've all done this before.
Mm-hmm.
It won't last. We will outlast them. We will keep on, keep on.
There are more of us than them,
That's right.
and the grassroots movement is big, and we just have to come together and take care of each other, engage in any way we can. Even one thing that we can do is a good thing. And but the thing to not do is stick our head in the sand and say, "Oh, whatever."
We cannot. We must. Let's see. You know, I was not to. I was reading in Isaiah 1. I do read the Bible. I that this is the foundation of my spirituality. Uh, and I read something where God says, I am just weary to the bone with you guys, speaking to the Jewish population at that time of Isaiah. And I just, are you like bone tired, bone weary? And I thought that first week I was bone weary. I was just tired. I was just tired. And I said to myself, I'm going to give up on that weariness. Okay. I'm going to move towards the one thing that I can make a difference in. The one thing. And to a certain extent, I'm trying to figure that one thing out. Maybe it's this, who knows? But what can I personally and professionally do to affect change in this world? Because we are all that drop that goes into the water and
Mm-hmm.
and rotates out into the world. And so if my drop splashes and it ripples out and it catches fire, and then somebody else's spark is united, or I'm sorry, ignited, power. Okay. And that's how we all, as grassroots, will collaborate and lift each other up and help each other. And we will be working on that through mutual aid, through mental health, and individually.
Well, Peggy, I think you have made a big ripple, and I think I mean your ripple somewhere, and a lot of other people who know you and of you and your work, and so thank you for making such a big ripple.
And I've already given away 2 sourdough starters, so I know I'm making it that way too.
Thank you so much for being here, Peggy. You've just been wonderful. You're a great friend and a model. And it's just a joy to have you here and to know you. And thank you to Birgit Van Ellie, our events director, who has put a wonderful event together for our MLK event in 40 Days of Peace. And she's also my tech assistant for today. Thank you to the audience for joining our broadcast. And remember to please join us and take action to be of service at we.net/MLK. Be a ripple yourself. And donations are greatly appreciated at we.net/donate. Goodbye from all of us at We the World.
Bye-bye.